it's Dr. Vidal and we are back with Tuesday Tips. We try to meet every Tuesday afternoon to discuss different topics in plastic surgery and to answer your questions. Last week I started this series called What to Expect. So we're going to continue that same series today. Last week the topic was mommy makeover. This week we're going to be talking about BBL or liposuction with fat transfer to the buttock and hips. So What to Expect series is not so much tailored to talking about the surgery itself or the science behind it or the surgical parts because I have a lot of videos talking about that. But the what to expect is more because I see a lot of patients repeating some stuff that they experience after the surgeries and that they don't understand, and sometimes they're scared and sometimes it's like, I wish I would have known this and that. So I'm gonna go over what are those things usually with BBL and why those happen, and then I'll get to answer your questions. And I'd like also, if you had a BBL and I don't mention something that you experienced, it's good that you tell me and mention it in the comments, and then we can discuss that too, okay? So let's start with swelling. BBL or lipo cases, swelling is gonna be there. And swelling, people think about swelling after surgery like, of course, it's surgery, of course you're gonna have swelling. But what most people don't understand is that the swelling is massive, okay? Remember, we are doing liposuction to the entire 360 torso. That means your abdomen, your waist, your back, it's everywhere. And because they're not big incisions, people don't associate liposuction with a lot of healing, because it's like, it's just a tiny incision and just removing the fat. You know, how much inflammation can it be? Well, just imagine a cannula suctioning the fat in and out in the entire torso. It's a lot of swelling because it's a lot of trauma to the tissue, okay? And I'm not saying this to scare you, not at all. I'm explaining what is it that entails, what happens, why the tissue swells so much, so you understand why this happens, and also you don't get scared, okay? And the swelling, it's not only in the surgical areas. I have people that's like, I didn't have surgery in my thighs and my thighs are so swollen. I didn't have surgery in my hands. Why are my hands so swollen? So with the liposuction, I mentioned the word trauma, right? So anywhere in our body where there's trauma, which is basically the cannula going in and out, the blood vessels release an inflammatory response. So there's cells in our body, the white blood cells that basically fight infection, but also are the wound healing cells. They secrete or release what's called cytokines, proteins, inflammatory mediators, because they sense that there's trauma, so they need us there. And all those mediators, what cause is basically, if you're thinking about the blood vessels like the highway, they're opening all the exits. They're making the cells going out to the tissue so they can go and repair. So imagine this not only in an incision, but your entire body. So the blood vessels are dilated, so open the highways, and not only open the highways, but open all the exits. So all the cells can go and heal, okay? So with the cells, it goes the water. So the water goes out as well. So the water is not in your blood vessels, it's in all the tissue, okay? And that's what's called swelling, okay? And swelling, it's not only gonna be there because the message is sent to your entire body. So all your blood vessels are open, and that cascade of inflammation is all over. So you see that very commonly that the next morning, your eyes are gonna, like, it seems that you got two punches, like very swollen, your lips are swollen, your hands are, everything is swollen. And it's that inflammatory response. That usually lasts for 2 to 3 days, and then it starts to get better in the upper parts of your body, but then gravity happens, right? All that swelling starts to linger down, and you see the legs get very swollen. The compression socks at that point are very important. And if you're in the older range of my patients, 40, 50 years old, there is some venous insufficiency as we age. So our veins, because they've been working all of our lives, the veins have the valves, right? And those valves with time don't work as well. And you may start to get more swelling in the lower extremities. So the compression socks help a lot, and I usually tell my patients to use them for a week. After a week, you can stop the compressions. But if you're in the older age or you have history of venous insufficiency, you may need to wear the compression socks for a little bit longer, okay? So don't be scared if you see your ankles are like this. It's like, what happened? I'm not pregnant. Why all of a sudden I have my ankles like when I was pregnant? Well, all the swelling is coming down and it's lingering there. So takes time, compression, elevation. How am I gonna, and this is a very common question, how am I gonna elevate my legs if you don't want me to sit in my buttock? How? So you're gonna be laying on your stomach, but you're gonna put a lot of pillows towards your legs so your entire body is tilted this way, okay? More pillows to the legs, less to the front, so your entire body is like tilted this way, and the swelling starts to come back to your heart and circulate all of that fluid, okay? So the first 2-3 days everywhere, then you start seeing it in the bottom. By 6 weeks, most of that swelling will be down, and you're gonna feel a lot better, but still, when you take the compression off, in 2 hours, you feel like you're super bloated again, okay? So that's gonna fluctuate, and that's why at 6 weeks, you start to decrease that 23-hour compression. So your faja, you're gonna start wearing it 12 hours a day to give your body time to absorb that fluid and kind of go back to its baseline. So by 3 months, you stop compression, but the swelling doesn't stop, okay? The swelling doesn't come down linearly like this with time. No, it goes more like this. It goes up, down, up, down, up, down, until it goes back to normal. So there are days that the swelling is gonna be worse, days that you're like, I'm getting out there, but then it goes back up, and that's gonna fluctuate until probably 1 year, okay? So you're in it for the long ride, and your results are gonna be better with time, but the swelling will kind of linger back, and kind of what things you can do, the compression, extremely important, your faja, massages, and also keep a low salt diet. Salt swells you up, okay? So try to eat low in salt, especially those first 6 weeks, okay? Bruising, that's gonna happen. We're going back to the trauma, the cannula going in and out, and you're gonna see bruising. For some people, and that's very genetic, and you can see it, some people get a bump and nothing happens, and others there's like a big bruise. It's part of that, right? It's a capillary leakage of blood. So there's some people that bruise more than others. If you're light colored skin, you're gonna see more bruising. Darker colored skin, less bruising, but anyway, anyone is going to experience some degree of bruising, okay? And the other thing that, don't get scared if you see bruising in areas you didn't have lipo. Again, gravity, okay? So that it's going to continue to come down, and there's people that have bruising in their thighs, and it's like, I didn't have a thigh lipo, why do I have bruising there? It's all gravity and kind of settling in, and the faja, the compression is kind of pushing it down too. So that is just gonna resolve with time, okay? So don't get scared if you see that. Pain, what to expect with pain? Pain is a very subjective thing, okay? And let's take, for example, delivering a baby. You can hear people saying that's the worst pain ever, and there's others that's like, it was a breeze. I just went in and out, baby popped out. And that's the reality, right? I can't tell you what's the pain level for a BBL because for everybody is different. But what to expect? Pain level between, so 0 to 10, 0 being no pain, like I'm right now, 0 pain, and 10 being the worst pain of your life. Again, it's subjective, but because if you were in a car accident with bone fractures, your 10 is very different than someone that hasn't experienced any pain or any surgery before, right? Again, we're talking about subjective. So I can tell you specifically for one person, a 10 is the worst pain you felt in your life, a 0 is no pain. For a BBL, you're gonna wake up probably in around a 5 to 7, okay? That's the goal, okay? You may be in recovery a little bit higher, but you're gonna leave the facility with a 5 to 7 pain, okay? 5 to 7, it's a discomfort, but you can tolerate it. I can't guarantee that you're gonna leave here with a 0 of pain because you had surgery, okay? And it involves soreness, discomfort, okay? But you're not gonna leave the facility with excruciating pain, okay? So you're gonna be in narcotics, you're gonna be in pain medications, you're gonna have narcotics. The day before when I see you in pre-op, I'm gonna give you the Percocet narcotics, so you're gonna bring it to the pharmacy and have it ready, and you can start your narcotics as soon as you leave. What are the things that help pain control? Not relying on only one medication. It's good to stagger medications. So you take your Percocet in 2 to 3 hours, you take a Tylenol extra strength, and then by the time the 6th hour comes for another Percocet, you maintain that pain level in a 2 to 3 instead of waiting for the 6 hours and that Percocet is down the drain and you are in a 10 again, okay? So it's better to keep it and staggering those pain medications so your pain level is controlled. Usually the pain is like that in between 2 to 5 the first 48 hours. The majority of patients say that after 48 hours, their pain is between a 0 and 2. Soreness with massages, uncomfortable but manageable with Tylenol and Percocet. Most of the patients after 2 to 3 days are off Percocet and okay with just Tylenol, okay? So again, a very manageable pain. First day is the roughest, but control with Percocet, okay? So dizziness and lightheadedness. This is a very, very common concern, complaint, and thing that you will most likely experience after your lipo case. Why? I talked about trauma, I talked about the inflammatory cascade, and all of this, what it does is, like I said, brings that water in from the blood vessels to the tissues. So you are in your heart and your vessels, they feel dehydrated. And I also remove 4 liters of fat in 2 hours. So your body is like, we need fluid back. This is not normal. I am in negative right now. So your body is, your heart rate may be a little bit high, you may feel a little dizzy, you may feel a little lightheaded, especially when you're changing positions, okay? The only way this is gonna get better is with hydration. That's why it's so important to stay on top of your hydration, at least 1 gallon of fluid a day, at least first week, especially those first 2 weeks, okay? But at least your first week, okay? And this is why having someone with you the first 48 hours at least is extremely important, okay? You shouldn't plan to be alone. Some people say, oh, I'm gonna have someone for the first night and then I'm gonna be fine. Don't plan like that, okay? You are gonna need assistance. You may still be lightheaded the first, 24 hours. And you need that person with you at all times, okay? If you want to go to the bathroom, for example, you'll need help to walk there, okay? To get someone to help you with the faja, to help you get in and out of the shower, okay? So this is very important to have someone with you. Why? If you get up, you can get dizzy and you can fall down, okay? And you can hit your head and it can be more dangerous than just your normal recovery, okay? So plan ahead, have someone with you, an adult that can help you and that's there with you, okay? The numbness and tingling, this is very, very common and a lot of people get very scared of this. The lipo, trauma, all of this that I mentioned also affects the nerve endings, okay? So it's very normal that the pain that you're gonna feel, it's at first like burning, okay? And after, when the nerve endings start to repair, you feel like pins and needles, like ants crawling, like you don't feel, and itches, but you scratch and you don't feel, and it feels weird. A lot of people say that the skin doesn't feel like theirs, and it's just those nerve endings kind of restarting to grow and go back to the skin. You will feel normal again, it just takes time, okay? It's not gonna feel like that forever, but it is something that majority of patients experience and a lot of you are scared of when you come for the follow-ups, like I feel that my belly is not my belly. I feel like this is another person's belly. And it'll go away, it'll go back to normal, okay? The tingling is also common in the hands, and this freaks out a lot of patients because like all of a sudden I have numbness, I can't feel my pinky and my ring finger. The reason for that is we have a nerve that goes here in the elbow, and we call it the funny bone. When you hit your bone, the elbow, and you feel like a current, that nerve is called the ulnar nerve, and it gives sensation and movement to these two fingers, the small and the ring finger. When you're sleeping with a BBL in your belly, what do? You go like this, right? So you can rest your head. And that's putting pressure on the ulnar nerve. So when you wake up in the morning, you don't feel your fingers. And you're like, I didn't have surgery in my hands or my fingers. Why I don't feel them? You just need to straighten your arms. So take turns, okay? So a lot of people feel better if you put a pillow under your head, but your arms are like this extended. So you give your ulnar nerve a rest, and that's gonna get better, okay? Appetite. This is very, very common. It's just like, I don't have an appetite. I eat something and I get full very easily. Combination of anesthesia and the faja. The faja is like an external pressure, so your stomach doesn't have the distension that it had before. So anything that you eat, you're gonna feel super tight, bloated, and you don't want to eat anymore. You still need to get your calories in to heal, okay? So if you're not able to tolerate big meals like you had before, then protein shakes are a good alternative to get the calories in, okay? Ensure, Lucerna, one of those, it's good, just something that you like. It's important to get your calories so your hemoglobin gets back up and you can heal better, okay? Fluid leak and the drain, this is going to happen. It's going to be messy. Those first 24 hours, you're going to be leaking fluid out of every incision. There's something called tumescent fluid. Tumescent fluid is it's by the liter. I mix a liter of normal saline with epinephrine, which is a medication that vasoconstricts. And that is injected in all of the areas of liposuction prior for me to start the liposuction itself, for the blood vessels to constrict to decrease bleeding, okay? So if I'm doing a 4-liter removal, I'm injecting 5, 6, sometimes 7 liters of saline and epinephrine, okay? So it's a lot of fluid. A lot of that fluid comes out with the liposuction, but a lot of that will leak out, okay? And there's also some what's called lymphatic drainage. The lymphatic system, it's affected because of the trauma, or same thing that I mentioned, right? So the lymphatic system is not absorbing that, okay? It's actually overloaded with all the traffic that the blood vessels are jamming out, all that fluid. So it's overloaded, so it starts to leak, okay? The drain helps, okay? That's why I leave a drain. The drain helps collect some of that fluid, but also it will leak from all the incisions. I only leave one drain in the anterior abdomen, so the incisions in the back, sometimes around the drain starts to leak. It's okay. Your body is just getting rid of that excess fluid, and that's fine. It's just, some people get scared because it's mixed up with your blood, so it may look very red. So some people think they're bleeding out. You're not. It's just the lipofluid. Just let it be. So one, don't be scared. Just let it, in the next 24 to 48 hours, it'll stop. And second, protect the areas where you're going to rest, okay? Especially if you're staying in a hotel, Airbnb, you may get extra charges if the mattress, if the sofa is damaged, okay? So bring pads, bring extra towels so you can cover the areas where you're resting, okay? And don't be scared, it's normal. And the BBL pillow. So plan ahead, okay? Plan ahead to be in a comfortable, for example, for the car rides, you want to, most people lay on the back with the legs bent, so you can be laying in your stomach on the back seat. There's other people that rent SUVs or trucks that have more space on the back. I've seen people that rent SUVs and then put an air mattress in the back, and then they're laying in the stomach. So I mean, there are people that get creative. That's the word that I was looking for. Thank you. Get creative, and that's okay. But also remember to bring the BBL pillow, especially if you're traveling. for your flight back, okay? Because for the flight back, you're gonna have to sit. You can do all these tricks in the cars and in your drives here, but for the flight back home, you're gonna have to sit. So your BBL pillow is gonna be super important. Difference between the boppy or the circular one and the BBL pillow, that it's like a rectangle. I prefer the one that's a rectangle. It's a little bit less comfortable, okay? Because all the pressure is in the thighs and no pressure is in the buttock area. So there's a little bit more balance and getting used to the BBL pillow that way. But the problem with the donut or the boppy pillow is that it may apply pressure on the hips, okay? So the circle usually is not big enough for the buttock and you still are applying pressure to some areas, okay? So just, you know, be careful with that. Same with the gravity shares, with the avocado inflatable to sleep, all of those things. The problem is the circle is usually not big enough to not put pressure in the lateral buttock or in the hip area, okay? So I'll take some questions. Let's see what you guys have.
Okay, first of all, there's a patient saying that wants to congratulate you for your second anniversary this June 4th here at Pure because she was your first patient.
Thank you. I love you. Yes, thank you so much. And I loved your pictures. She sent me pictures, I think it was a couple of weeks ago, and you're looking great. You're beautiful. Thank you.
Okay, let's start with the questions.
Yes.
With Mommy Makeover, when do you start massages?
Massages for a mommy makeover, same as for BBL, the next day, okay? So surgical massages, the first few weeks are gonna be just manual lymphatic drainage massages. For the mommy makeover, they're just gonna be focused in the areas of liposuction, so the waist and flank area, not the areas where the incisions are. At 2 weeks, they can start massaging the incisions, okay? So plan for the first week, usually the first few days that you're here in Miami, if you're traveling from out of town, try to get 1 massage a day. After the first 7 in a row, usually, everybody's different, but usually you can start to win them off.
Okay, hello. Following a BBL, what are the signs of low hemo?
So anemia or low hemoglobin, it's gonna feel a lot like this. So it's very hard to differentiate it, especially in the first few hours/days, the first 24 to 48 hours. If you're not getting better with hydration and rest, and your heart rate is very high. So normal heart rate for everybody's a little different, but a heart rate after surgery of 110 to 120 when you're walking is very normal. A heart rate that does not improve when you're sitting or laying down, that's not normal, okay? So your blood pressure and your heart rate should regulate when you're sitting. When you're walking, exacerbating, moving, it may go up, and that's gonna improve after a few days. But if that doesn't improve, if your dizziness doesn't improve when you're laying down, if you're not feeling better, give us a call. We have a way to check your hemoglobin here in the clinic to make sure that everything is good.
Can we take our prescribed Xanax the night before surgery?
That depends, okay? So message through Clara to see specifically the dosage and the reason for your medication to take, and we can let you know.
If you are a VSG patient, we have to stop taking our vitamins.
So same thing. Write us through Clara. It depends the vitamins that you're taking. Usually, like the bariatric patients are taking B12, iron, and some of those I'm gonna also restart you. So I just don't want you to be taking extra of the supplements. But you can, depends on the specifics. You can continue some of them. So just write us through Clara and we'll tell you specifically.
Can we take saffron after surgery if very nauseous?
Definitely. I'm gonna give you a saffron prescription. So nausea after surgery is very common. It's a combination of the anesthesia and also the fluid losses and the pain. Also, Percocet can get you nauseous. So I always give a saffron prescription to all of my patients to have available in case you have nausea to take it.
Hello, Dr. Vidal. Don't know if this is an appropriate question, but what can make
No, it is.
It is. I read it.
You make me nervous here.
But what can make your body reject breast implant?
So rejection of a breast implant, it's a very broad term, okay? So let's talk about the two most common or three most common things that when people experience that, they call it rejection. One is wound healing problems. So especially if you're doing a breast lift, there are a lot of incisions that need to heal. Sometimes those incisions open up and the implant is exposed. There's some people that refer to that as your body's rejecting the implant. Not necessarily, it's just that the wound opened up and the implant is exposed. That's very rare that happens, but it's never zero. I put my implants when I'm doing a breast lift under the muscle to have an extra layer of protection in case we have any wound healing problems, but it's never zero, okay? So if that happens, if we have implant exposed, then their solution to that's removing the implant, okay? So that's one of the things that can happen. The other thing is an infection. So there are a lot of things that I do to try to avoid infection, but in a foreign body, an implant, if it gets infected, we have to remove it. And some people, when they experience that, they call it that the body rejected it. And the third one is capsular contracture. So capsular contracture is that the body, every foreign body that is placed in our body forms a capsule or scar tissue around it. And for breast implants, that happens. And that happens to everyone. So if you have a breast implant, your body has created a capsule around it, and that's not something bad. But if the body, similar to like a hypertrophic scar or a keloid, forms extra scar tissue around the implant, then that capsule may become painful, hard, or deform the implant, make it harder or higher, and that's called capsular contracture, okay? Some people refer to that as their body rejecting the implant. It's not specifically that they're rejecting it, is that that scar tissue is forming. So it depends on the grading or the severity. Some alternatives are massaging, medication, and others are surgical interventions. So those are the three most common things that happen.
Should we take pineapple and arnica pills before surgery?
So before surgery, it's not going to harm you, but I don't think it's going to affect a lot because the inflammatory cascade that I mentioned hasn't started, okay? So you can, but I'm not sure if it's going to make a difference. It's definitely not going to harm you. So if you want to do it, that's okay. But make sure that you're not taking bromelain supplements, that it's pineapple juice and arnica itself. Bromelain increases the risk of bleeding, okay? So that's okay if you want to start before. After surgery, I do recommend them because I do think that makes a difference with the post-op swelling.
Following a BBL, what can we take for the itching, and the same question for the burning feeling?
So yes, it's very common. People ask me this, and very good question. Thank you for bringing it up because I mentioned that and not a solution to it. So Benadryl or allergy pills tend to help. Okay, so Claritin, Loratadine, those tend to help with the itching. I think that also like external measures like warm shower, warm pads over your skin helps because remember it's numb, so you're gonna be scratching and you're not gonna feel a relief. So those warm baths tend to help a lot. And if it's very severe and hasn't improved, then we can try some nerve pain medications such as gabapentin, but I leave those for last resource because they have their side effects. And like I said, most of this is temporary, and with just Benadryl and time, it'll improve.
And the last one, we're running out of time, is what happens if you get a minor cold symptoms prior to surgery?
You let us know. That's the straight answer. It depends, okay? So minor cold usually is okay, but I'm gonna have to go ahead and ask you specifics on what minor means to you because that's a little bit different for everybody. And then we discuss it with anesthesia providers, and we determine if we can proceed with surgery. Awesome, guys. So thank you so much for joining. I hope you're enjoying this What to Expect series. I'll probably do a breast implant, what to expect breast implant one next week, so don't miss it. If you have any questions, if you have any topic that you want me to discuss, let me know, DM me, and I'll see you guys next week on Tuesday Tips. Take care.